If you wake up again and again at night to pass urine, if your sleep is broken every night, if you feel tired in the morning, even after going to bed on time, you may think this is just part of aging. Many people ignore it for years, but nighttime urination is often the first warning sign. It can be a sign from your bladder, your prostate, or even your kidneys, and ignoring it can slowly damage your health and quality of life. Nighttime urination means waking up from sleep one or more times to pass urine. In medical language, doctors call this nocturia. Simply, it means your body is making too much urine at night, or your bladder cannot hold urine properly during sleep, or something is irritating your bladder or urinary passage. This problem is very common. Many adults above the age of 40 experience it. Both men and women can suffer from it, but men experience it more often as they grow older. People delay seeking care because they feel embarrassed. Some think it is normal aging. Some think it is due to drinking water at night only, because it is not painful. Many people ignore it, but repeated nighttime urination is not normal. Now let us understand why nighttime urination happens. First, let us talk about lifestyle-related causes. Drinking large amounts of water late in the evening is a common cause. Tea, coffee, and soft drinks at night increase urine production. Alcohol before sleep relaxes the bladder and increases urine. Irregular sleep habits disturb bladder control. Obesity increases pressure on the bladder. Lack of physical activity worsens bladder function. Diet also plays an important role. High salt intake causes fluid retention during the day. At night, this fluid shifts back into blood and becomes urine. Spicy foods can irritate the bladder lining. Artificial sweeteners can increase bladder sensitivity. Heavy dinner late at night increases urine production. Now let us talk about medical causes. Enlargement of the prostate gland is a very common cause in men. The prostate sits below the bladder. When it enlarges, it blocks urine flow. The bladder cannot empty fully. This leads to frequent urges at night. In women, weakened bladder muscles after childbirth can cause this problem. Urinary tract infection causes burning and frequent urination. Diabetes causes high sugar in blood. Excess sugar pulls water into urine. Heart disease causes fluid to collect in legs during the day. At night, this fluid returns to blood and becomes urine. Kidney disease reduces urine concentration ability. Sleep apnea causes repeated waking and increased urine production. Neurological diseases affect bladder nerve control. Now, drug-related causes are also important. Some antidepressant medicines affect bladder control. Certain medicines for heart disease increase nighttime urine. Now, who is at higher risk? Older adults are at higher risk. Men with prostate enlargement are at high risk. People with diabetes or heart disease are at risk. People who drink excessive fluids at night are at risk. People with kidney disease are at higher risk. Now let us understand what happens if nighttime urination is ignored. Sleep disturbance is the first major problem. Poor sleep leads to daytime fatigue. Concentration and memory are affected. Risk of falls increases, especially in elderly. Repeated waking increases anxiety and depression. Bladder symptoms usually worsen with time. Prostate enlargement may progress silently. Kidney disease may remain undiagnosed. Blood pressure control becomes difficult. Quality of life reduces significantly. Now let us understand why this problem worsens over time. Underlying causes continue to progress. Bladder muscles become overactive. Sleep cycle becomes disturbed permanently. Patients develop fear of sleeping deeply. They start restricting fluids incorrectly. This can cause dehydration and kidney problems. Now let us discuss how doctors evaluate this problem with prevention in mind. Doctors first ask detailed history. Number of times you wake up is important. Amount of urine passed is important. Timing of fluid intake is assessed. Associated symptoms like burning pain or weak stream are noted. Doctors examine blood pressure and body swelling. Simple tests are done. Urine test checks for infection, sugar, or protein. Blood sugar test checks for diabetes. Kidney function blood test checks kidney health. Ultrasound examines bladder, kidneys, and prostate. Post-void urine test checks how much urine remains after passing urine. This tells if bladder empties fully. Sleep history helps identify sleep-related causes. Now let us talk about prevention and long-term control. Lifestyle modification is the foundation. Reduce fluid intake 2 to 3 hours before sleep. Do not stop water completely during the day. Limit tea, coffee, and alcohol in the evening. Maintain healthy body weight. Regular physical activity improves bladder function. Elevate legs in evening to reduce fluid shift at night. Develop fixed sleep schedule. Dietary changes are very important. Reduce salt intake during the day. Avoid spicy foods at night. Avoid artificial sweeteners. Have lighter dinner at least 2 hours before sleep. Hydration advice must be balanced. Drink adequate water during daytime. Spread water intake evenly. Avoid large volumes at one time. Proper hydration protects kidneys and bladder. Now let us talk about medications. Medicine choice depends on cause. Prostate enlargement medicines relax urine passage. Bladder calming medicines reduce urgency. Diabetes control reduces urine volume. Heart disease treatment reduces fluid overload. Never start medicines without doctor advice. Prevention reduces future risk significantly. Early treatment prevents bladder damage. Proper control improves sleep quality. Falls and injuries can be prevented. Kidney health is protected. Now let us conclude. Nighttime urination is common but not normal. It is often a sign of an underlying problem. Early evaluation can prevent complications. Lifestyle changes play a major role. Proper diagnosis leads to effective treatment. If this video helped you understand your symptoms, please like this video. Subscribe to this channel for weekly kidney, bladder, and prostate education. Comment your questions or topics you want us to cover next, and share this video with someone who may benefit.